You're welcome back. Now, 30 frontline health workers have contracted coronavirus in the Ashanti region. This was announced by the Ashanti Regional Health Director this morning at a news briefing.
We have a total of 30 health workers having COVID-19 in the region. When we say health workers, we mean health workers, frontline health workers. Some of them are doctors, nurses, paramedics, and then even health assistants, mortuarymen. They are all part of it. Yes. So that is the situation. That is the situation we find ourselves. But the good thing is that all of them are doing very well. Yes. Some of them have recovered. They've returned to their work. But that is the universal way of getting the infection. Usually, health workers and those who are close to the infection, that will always get it. So it's not a big news, but that's the situation in Ashanti region.
He says that's the situation in the Ashanti region. Let's try and get some more details on that. Ohime Interior was at that briefing. He joins me via Zoom. Hello, Ohime. There are coronavirus centers. So if you take the University of Ghana Medical Center, you know it's a center. How do we know where these health personnel are?
Unfortunately, the Regional Health Director, Dr. Emmanuel Tinkwen, wouldn't want to go public with the identity or where the facilities where these health workers who have contracted COVID-19 work. But what he did say is that some of them have recovered. And for him, it is not big news because follow the COVID-19 history, he says all over the world, that has been the trend. Health workers who are always at the front line, they are the ones who always get tested positive for the virus, so it's not a big deal. But for us as journalists, we think that this is a big deal because if health workers who are supposed to manage the condition and also manage the condition of other members of the public contract the virus, then we are looking at the impact that this would also have on healthcare delivery in the region.
Exactly the point. But Ohime, I know he doesn't give you a lot of information, but let's try this. Do we know whether the absence of PPEs, which is a big issue, which is something that health personnel have complained about over and over again, do we know if it has anything to do with how they got infected?
I have been looking around for some information, some details on these health workers who have tested positive for COVID-19 in the Ashanti region. And the information I take is that some of them have no idea where they contracted the virus, though some of them are, yes, majority of them are frontline workers. They can't pinpoint one reason or one particular point where they contracted the virus. It's interesting to know that some of these health workers, at the time that they tested positive for the virus, they were not actually on duty. And interestingly, it's only a few of them, like, who have tested positive, but their families, some of them have their families who are not also tested positive. So it makes it a bit complex analyzing this situation. But yes, we understand some of the, for instance, mortuary attendants also tested positive for the condition. And for them, they are not even too sure whether they contracted the virus while working at the facilities that they work with. Yes, but yes, it comes to mind. I have an idea where some of these health workers who have tested positive for COVID-19 work.
Interesting, Ohime. And at the press conference, what else did he say, the Director of Health?
Yes, the Regional Health Director was happy for the very first time. If you look at the graph for COVID-19 management in Ashanti Region, Ashanti Region did not record a new case for the very first time for several weeks as of yesterday. So I would say health authorities have been passing their back for these particular factors that they have chalked. And they say that if you look at the COVID-19 transmission in general in Ashanti region, you could say that yes, the numbers are going down, and especially in Obuasi, which has become more or less the new epicenter of the virus in the Ashanti region. At least 587 cases have been recorded in Obuasi. And he says, yes, even in Obuasi, the numbers are coming down compared to what they recorded somewhere in April. He says in April, between April 19th and April 27th, that is where majority of the cases were recorded in Obuasi. But unfortunately, thing is that because at that time, the laboratories had a backlog of cases and they were not releasing their results. By the time they released them, it looked as if Obuasi was recording new cases. But even then, they have dealt with the cases, with the improved and intensive surveillance and then contact tracing and other protocols that they have introduced to bring the Obuasi situation under control. So yes, health authorities, especially regional health directors, says they are happy that the situation is improving and has improved in the Ashanti region. It's an indication that they have been doing the right thing as far as management of COVID-19 is concerned. And he says, yes, they are going to do the same thing and improve on this so that Ashanti region will continue to record a positive record as far as COVID management is concerned.
Very much for that update there. Ohemin Teria is of our health desk, bringing us up to speed on the situation in the Ashanti region. We're learning that the cases have declined in Obuasi. We're learning that unfortunately 30 health workers, frontline health workers, have contracted coronavirus there. Certainly, like Ohemin is saying, it will have an impact on healthcare delivery in the region.